Senator from Nevada.
Mr. President, I ask that the quorum call be dispensed with.
Without objection, the senator is recognized.
Mr. President, I rise today in support of the amendment offered by the Republican leader to repeal what I believe is this unconstitutional government takeover of our healthcare system. Make no mistake, we all want to improve access to affordable health insurance for all Americans, including those individuals with pre-existing conditions. But unfortunately, this health reform bill that was signed into law last year is not the right prescription. Over the past year, I have spoken with tens of thousands of Nevadans about this bill. They were very clear when they said that this law is not the cure for our broken healthcare system. This law imposes new burdens on most Nevadans and most Americans. It requires that every American citizen purchase health insurance coverage. Those who fail to buy health insurance that meets the minimum requirements are subject to financial penalties. Just 2 weeks ago, I received an email message from Tommy Felt, who's a Boy Scout in Las Vegas. This is a picture of Tommy. He's just 12 years of age. He attends Mulaski Junior High School, and he's working to earn his citizenship in the National Merit Badge. Tommy's email stated that, "I'm really concerned that the bill will damage our country. I think it is unconstitutional for the government to force citizens to buy health coverage. Also, I believe that the hidden costs in this bill will drive our country much deeper into debt. My dad says that this bill will lead to the elimination of senior dimensions and Medicare Advantage plans for our seniors." Well, I wish that more than half of my colleagues would heed the words of this young 12-year-old. I couldn't agree with Tommy more. I am also concerned that this health reform law will destroy our healthcare system in this country. I'm also concerned about the unprecedented overreach of the government's demand that every American purchase health insurance just because they live in America. The judge, as we've all heard, in Florida ruled that this bill is unconstitutional. Let's ask the question, is it really constitutional for the government to tell all Americans that they must buy health insurance? What's next? What personal liberty or property will the Congress seek to take away from Americans next? Will the government mandate what cars we're allowed to drive or what food that we feed our children? Mr. President, where do we draw the line, or will we even draw one at all? After all, the Constitution is about enumerated powers, specific powers given to the Congress. This bill blows the lid off of those enumerated powers. Now, I've spoken at length about the unconstitutional provision and even raised a constitutional point of order before the Senate voted to pass this reform bill. As I mentioned earlier this week, the Florida judge ruled the individual mandate unconstitutional, and even went so far as to say that the whole bill is unconstitutional because it cannot be separated out. In December 2010, a federal judge in Virginia also struck down the individual mandate as unconstitutional. Now, we know it could take several years for this case to reach the Supreme Court of the United States, and my good friend from Florida, Senator Nelson, talked about expediting that procedure. I think that makes a lot of sense, so that we don't have to wait several years for the Supreme Court to reach its decision. The administration should ask for that, and the administration has the right to bypass the Court of Appeals and go directly to the Supreme Court. But in the meantime, because it may take that long, several years, we should act to repeal this law before we begin to suffer under its tyranny. Now, going back to Tommy, his email addressed the significant costs associated with this health reform bill. Tommy has every right to be concerned. In fact, every American should be concerned. Spending in this country has continued to spiral out of control. The health reform law is only adding to our financial demise. Unless repealed, the law will further exacerbate the cost of health care, explode our deficit and debt, and forever alter the relationship between the government and the American people. Now, we hear from the other side that this is going to reduce the deficit, that this bill is, because there were $500 billion in cuts in Medicare, increased taxes. Those cuts in Medicare, by the way, that Congress could repeal and often does. They also used fuzzy math when this bill was being debated. A lot of the savings in Medicare were counted twice, and that's why the Budget Committee on the Republican side that did the study said that this bill will actually increase the deficit in the first 10 years by $700 billion. I mean, let's just take some common sense. Do you think you can increase the Medicaid rolls by 16 million people in America and actually cut costs? Does that make any sense to anybody? Increase Medicaid rolls, which are paid by the federal government and the states, and we're actually going to decrease the deficit? That just defies common sense. Many small business owners in my state are already seeing a dramatic increase in their health insurance premiums. This bill was supposed to bring down cost. It's doing exactly the opposite. I've met with with many companies across our state, but with 3 large companies that I met with, they've actually tell me that they're considering, because of the cost standpoint, dropping their health insurance, paying the $2,000 fine per employee, because it makes cost common sense to them. They can pay their employees a little stipend. They can put their employees on the government system, and they're money ahead. Well, with businesses struggling just to make it today, people are actually looking. This could be the difference between staying in business and not. So they are looking at huge increases in their premiums or paying the fine and putting people on the government system. That's one of the reasons that I think that this bill is going to massively increase the federal debt. This law does not help the typical Nevada family who purchases insurance in the individual market either. In fact, traveling this state, I met with Nevadans who are already seeing increases in their premiums. The estimates are for individuals, it's 10 to 13% increase in their premiums because of this bill. But small businesses that I've talked with, the increases already that they're seeing this year are somewhere 15 to 30%. A few of them around 8 or 9%, but most of them are between the 15 and 30% range. And in my state, unfortunately, about 70% of all businesses, their health plans won't qualify for the minimum plans in this government that this government is going to mandate starting in 2014. Well, in Tommy's email to me, he also mentioned Medicare Advantage. There are more than 100,000 Nevada seniors who choose a Medicare Advantage plan. Well, these Nevadans are not better off because of this reform. Their extra benefits actually will be reduced by more than half. This bill doesn't help middle-income workers in Nevada either. Our hardworking hotel housekeepers, casino restaurant workers, airline workers, teachers, police officers now look forward to collective sharing the burden of the $200 billion tax on health insurance holders. Many American workers will pay for new taxes and penalties with reduced wages and lost jobs. Oh, and by the way, there's also new taxes on prescription drugs, clinical lab work, and medical devices that will also get passed on to the American people. Simply put, I believe that this health care bill is a job killer. My state cannot afford to lose more jobs. We have 14.5% unemployment in my state, 9.6%, 4%, something like that across the nation. We can't afford to lose more jobs. Well, I'm sure that many of us have heard the phrase that the devil is in the details. Well, truer words could not be spoken when talking about this healthcare reform bill. We know when Democrats passed this legislation that they were given enormous discretion to the Secretary of Health and Human Services. But I don't think that any of us could have fathomed that the 2,000-page bill would generate potentially up to 20,000 new pages and regulations. And I printed off many of the regulations in the bill here before us today. I'm going to look at the size of this thing, and they're not even close to done writing the regulations. I challenge anybody with any company or any American to try to understand this bill and its regulations. It's virtually impossible. It takes a team of lawyers and healthcare experts to even come close to understanding all the implications of this bill. According to my staff's calculations, so far about 6,200 pages in regulations. As I mentioned before, this could go to at least 20,000 pages. I think it's safe to say that the devil really is in the details with this health bill. The American people are going to learn more about its unintended consequences of this legislation as more and more of these regulations roll out. Remember last year when Nancy Pelosi said, well, we have to pass the bill, now we can find out what's in it? Well, we may be able to find out what's in it if you can understand it when you get through all of this. I wonder how many people in this body have actually read not only the legislation, but the regulations. It's absolutely daunting. This health care reform bill, with all of its new taxes, funding cuts for programs that they rely on, and raised premiums, which is why we should be repealing this bill. Instead of doing so, however, this administration is granting special waivers to various provisions in this law. These waivers are basically exceptions to the rules, and they allow organizations to circumvent the standards required in this health reform law. So if waivers are needed, isn't that proof that the health care reform bill is problematic? Isn't it proof that this health care reform bill isn't working? Or are special interest waivers a greater priority than the plight of the American people? It's interesting to me that some of the biggest supporters of this law have been working behind the scenes so they can obtain special waivers so they get out of complying with this law. They won't be held to the same standards as businesses in Nevada. Nevadans are not behind this bill. American people are not behind this bill. But there is no doubt that we need to improve health care in the United States. What's the primary problem with health care in the United States? New senator from Kentucky said it best. It's too expensive to buy health insurance in the United States. This bill does nothing but make that problem worse. The people of this country did not sign up for the kind of change that brings with it billions of dollars in new taxes and potentially a loss of their current insurance coverage or a choice to decide which coverage that they have. The American people don't want a bureaucrat coming between them and their doctor. Now, turning my attention back to taxes just for a moment. This bill alone ensures that hardworking Americans hand over even more of their paycheck each month to the government. It's funny how reforming health care means more money for Uncle Sam. There's also a new tax on certain employer-provided health care, the so-called Cadillac plans. There's taxes on drug companies, medical devices, indoor tanning services, and the onerous 1099 reporting requirements for small businesses that apparently even President Obama opposes now. He said in the State of the Union address that we need to fix parts of the bill that need fixing and move forward. Well, I believe this whole bill needs fixing. So let's repeal it and replace it with real health care reform that actually attacks the cost, which is the number one problem in health care in the United States. We can go back to the drawing board, take the best ideas from both sides of the aisle, put together a health reform bill that will take us into the future. Republicans have come up with many ideas on ways to fix the nation's broken healthcare system. The answer is not unbearable taxes, unsustainable growth of the government, or paying for a brand new entitlement program. Those aren't the qualities of comprehensive health reform. They're the qualities of terrible policy that will lead to devastating results for Americans and our healthcare system, which is the best in the world. There is a better way. It will take time, but if we can change the way that Americans think about healthcare, then we can create a better system. Imagine a system where Americans get to keep their choices in healthcare and where they're allowed to buy insurance across state lines. Imagine a system where there's transparency, where you know how much your doctor's visit will cost and how much your surgery will be. Ask yourself, when was the last time you went to a doctor's office and got a written estimate? This third-party payer system we have, somebody else is paying the bill, you're receiving the service, doctors don't care what you think of the cost. So there is no transparency in today's system. We need to have a system that's transparent where you can shop around for the best value for your money. And imagine a system that rewards individuals for engaging in healthy behaviors. Imagine a system where you're not punished for having a pre-existing condition. Imagine a system that allows small businesses to pool their purchasing power together to provide health insurance to their employees through small business health plans. Imagine a system where doctors can practice medicine to heal patients instead of practicing medicine with the goal of not being sued. And imagine a patient-centered healthcare system, not an insurance-centered system, and not a government-centered system, which is what we have today. These are all standards that we should work towards. We can't afford to settle for this bill. This bill. This bill, I believe, will bankrupt our country, our families, and our neighbors. We simply cannot survive with this agenda of taxing and spending away for our future. We can't survive it. We cannot afford it. So, Mr. President, I believe that we should repeal this bill. All of its pages, all of its regulations, all of the regulations to come, and work together, not as Republicans, not as Democrats, but as Americans, to address the primary problem in healthcare in this country, and that is the cost. It is critical for the future competitiveness of American business. It's incredibly important for the quality of healthcare for the future of our citizens as well. Mr. President, I yield the floor.